just the use of something like low-level movement, and it's almost like a tremor, but also these like short, small, fidgety movements. I'm intentionally doing a lot of these today, so you have examples that you can use to select from if you like. These can have a major effect on fat loss. And it raises a second tool. If these low, meaning these small movements that we engage in, trigger epinephrine, adrenaline release from these neurons of the sympathetic nervous system that innervate fat and increase fat mobilization and oxidation, now it should make sense why shivering is one of the strongest stimuli that one can incorporate to stimulate fat loss. Now, shivering is almost always associated with cold. We think shivering, we think cold, because when we get cold, we shiver. And there are two ways that shivering can increase fat loss. And there are several ways that you can use shivering, you can leverage shivering, and you can leverage cold to accelerate fat loss. But you have to do it correctly. So let's talk about how to use cold and how to leverage shiver as a particularly strong stimulus to increase fat loss through mobilization and oxidation of these fatty acids. So how many times a week do you need to expose yourself to cold will depend on how much fat you're trying to lose and how much you're trying to increase your metabolism. There are studies that describe positive effects on fat loss of exposing yourself to cold either through cold shower or through ice bath or other cold water. It doesn't have to actually have ice in it, provided it's cold enough, for anywhere between 1 and 5 times per week. But it turns out that just one exposure per week can be valuable. The question then is how long to get into that cold environment, and how cold should that environment be? It turns out that if you want to trigger the shiver, what you want to do is to get into the cold and then get out of the cold, and typically not dry off, and then get back into the cold and out of the cold. That will definitely stimulate more shivering than just getting into the cold itself. So what I'm not referring to is getting into the cold environment like an ice bath and waiting until you shiver and staying there shivering. Okay? You also don't want to get hypothermic, and I want to be clear, you want to get approval from your doctor before you do any of this. When you get into cold water, there are 2 factors that will dictate whether or not you shiver. Probably 3, but let's just talk about the main 2. One is how cold it is. So how cold should it be? And look, if you get into water that's very, very cold, it can actually shock your heart. It can actually give you a heart attack if it's truly, truly ice cold and you're not adapted to that. So proceed with caution, please. I'm not a physician, and I don't want to see anyone get hurt. Cold, just cold enough to be uncomfortable is a good place to start. So for some of you, that's going to be 60 degrees. For some of you, that's going to be 55 degrees. For some of you, it's going to be high 30s, right? Depends on how cold adapted you are, and people vary in terms of how well they tolerate the cold. So what you need to do is find a temperature that you can get into 1 to 5, probably 1 to 3 times a week if you really want this to accelerate fat loss. And you want to get in until you just start to shiver, and then you want to get out and not dry off. Wait anywhere from 1 to 3 minutes and then get back into the cold.